Welcome back, viewers. My name is Caroline Bide. This is the Afya Leo program. And remember, as I told you earlier, you can be part of our program by supporting us via our till number, that is 96268895. 96268895. And you can keep your comments and your questions coming via the number on your screen, that is 0711352883. And we're talking about urinary tract infection. And welcome back, Nasroda. Before we went for the break, we were talking about signs and symptoms. Now we will be talking about prevention. What are the measures that are taken in managing UTI?
Okay, thank you very much. We said prevention is part of management. Actually, we want to know how to manage UTI. And the first management is prevention. So we can prevent UTIs. It is easy to prevent. Factor number one to prevent is hygiene. I said most of the microorganisms, they penetrate to our bodies through our external environment. And hygiene can help us so much, especially the fungus. Most of the fungi or the fungal UTI is caused through contact, that is skin contact, and therefore from our hands, from objects, from our sanitation. So if we are able to maintain good hygiene standards, it can be a good measure to prevent UTI. And this applies to all. So even our children, we can educate them. Even especially those who are going out for business and other things. It is good when you come into your house, or rather if you want to use the loo, always clean your hands. It's always good to protect your body by cleaning our hands. This regular cleaning of our hands, maybe it has come up recently, seriously,
Because of
but
the corona.
but it has been there and it has been very important. So it is good to keep good hygiene measures. Also, we can do this by saying the hygiene, I say the health, seeking health services as early as possible. Most patients come for intervention when it's too late, and therefore we are not able to prevent complications. So I would like to say, once you experience the signs and symptoms we said, and even though they are not severe, let's seek medical interventions early. So seeking health services early is another way of preventing actually complications. And also we can prevent by, or rather we can manage by treating the infection. So once it has already set in, we know it can be affecting the upper urinary tract system or the lower one. The urinary tract infection is divided into two. There is the upper region, which is the urethra and the bladder. Sorry, the lower region, which is the urethra and the bladder.
Okay.
Then the upper region consists of the kidney and the ureters. The ureters are the connection between the bladder and the kidney. So management now is based on the level of complication or illness. So once the patient is diagnosed, or rather clinical signs make us to know or to interpret UTI or to diagnose UTI. Clinically, we can do, before even we treat, we can send for some investigations, especially the urine for microscopy. And remember, these patients can come with fevers. So when the patient has presented with all these symptoms, now there is fever, there is pain, there is so much. So we also narrow down to considering other infections. So we do investigations first, if we are in a setup that we can do so.
Okay.
And also, we can treat fast, because some of the signs will automatically tell you this is UTI. So there are drugs to manage. There are other basic laboratory tests to do even before management. So it depends on the clinical appearance and the clinical presentation. But the best way to treat or to manage is prevention. And also when we treat and talk about prevention, we also need to talk about other things like hydration. Hydration is taking in a lot of fluids, and especially water, because it helps to clean the kidneys. So when our kidneys are cleaned regularly, then they are not prone to infections. So there is need for hydration.
Okay.
Yeah.
And well, we're still there. There's someone who's asking about. I've been going for the treatment, but it's recurrent. The UTI has been recurrent. What might be happening?
Okay, we have experienced such patients who come recurrently for UTI treatment, but I think the best way of managing is prevention, because as much as the patient received a lot of treatment with the drugs, and they finished their dose, but there are other measures, like I said, prevention through hygiene. Also, there is hydration. Also, there is nutrition, that is balanced diet. Also, considering the foods that we take, there are some things that need a lot of water, a lot of fluids, so that they can be absorbed and excreted. Also, this person could be having another complication, and therefore, I think depending on where this person is going to the hospital, there needs to be further intervention. Maybe this person can be seen by a physician who will consider what to do or the lab test to do, and then from there they can be managed. But maybe this person is someone who needs to take in a lot of water, someone who needs to raise the standards of hygiene. Yeah.
Okay. And what are the complications that come with UTI?
UTI, if not treated well or if not treated early, it can bring complications to the lower region, that is to the upper region, sorry, that is to the kidneys. So this small looking infection, if not well managed, we can have some kidney complications. And you know, kidneys, they have the biggest functions in our bodies. Actually, mostly the kidneys will be dealing with fluids, balancing of fluids in our bodies. They have a key function, that is what I mean. So if UTI is not well managed, or if it is managed poorly, it can lead to kidney complications. And you know, kidney failure is a disease or a complication that it takes a lot of power to manage or even to cure. So it's the best thing we can do is seek health services as early as possible.
Okay, and UTI is treatable, right?
Yes, it is
Inapona
treatable.
kabisa.
Yes.
Okay.
Yeah.
Now, because my director is ako tu pale anapiga kelele masaa, you can have your last word with our viewers.
Thank you so much.
Yes.
Viewers, thank you for listening to me. And this time I want to say that these signs and symptoms, they are not, sometimes they may not occur and tell you that you have UTI. So the best way is prevention. Let's raise our hygiene standards. Please, before you visit the loo, let us clean our hands. Men, I know it is very easy for you to do this because your systems are just well located. So please maintain hygiene, hand washing, take care of your sanitation, drink a lot of water, then we shall protect our kidneys. God bless you.
And maybe someone wants to reach you personally, akona kitu. She or he might be wanting to talk to you direct. Just share your contact, mahali wanaweza kupata.
Okay, you are there, you want to talk to me, maybe you have a problem that has disturbed you for long, My number is 0720-818-994. I'll repeat, 0720-818-994. Welcome.
Thank you so much for your time, and thank you for coming.
Thank you.
And thank you for keeping in touch. Thank you for the love. You guys are amazing. Nayo mapenzi, mnajua kutuonyesha mapenzi. Thank you for watching. My name is Caroline Bithe. See you next time.